Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Sensory loss in case of peripheral neuropathies. So first let's look at the symmetric loss and then the asymmetric loss. First, when you look at the symmetrical loss. So let's look at symmetrical loss. So here in symmetrical loss, it includes a cryptogenic idiopathic sensory polyneuropathy. So there is CSPN. CSPN stands for the cryptogenic. So there is cryptogenic as well as the idiopathic. So there's cryptogenic as well as the idiopathic sensory polyneuropathy. Next is the involvement of the DM. DM stands for the diabetes mellitus as well as the metabolic disorders. So there's also the presence of the metabolic disorders. Next is there's involvement of drugs. So there's involvement of drugs as well as presence of the toxins. So these are all the symmetric losses. Symmetric, there's cryptogenic, idiopathic, sensory polyneuropathy, there's CSPN, there's diabetes mellitus, metabolic disorders, there's drugs, presence of toxins, then the familial as well as CMT amyloidosis. So we saw the familial HSAN. Then comes the presence of CMT as well as amyloidosis. Next is the involvement of the inflammatory. So there's inflammatory demyelinating. So there's inflammatory demyelinating polyneuropathy. So inflammatory demyelinating polyneuropathy, this includes the GBS. As well as the CIDP. Now let's look at some asymmetric losses, asymmetric sensory loss. So here an asymmetric sensory loss. So in terms of asymmetric sensory loss, it includes the cancer. So there's involvement of cancer. Cancer means it is paraneoplastic. So cancer means it is paraneoplastic, and then it also involves the Sjogren syndrome. Then is the idiopathic sensory neuropathy. There's idiopathic sensory neuropathy. That is idiopathic sensory neuropathy. Then there is a possible GBS variant. There is a GBS variant which is possible. So then what are the other things involved? In asymmetric loss, there is cancer, Sjogren syndrome, idiopathic sensory neuropathy. Then comes the involvement of the cisplatin. So there's involvement of cisplatin. So cisplatin, then comes the other chemotherapeutic agent. Then there is other chemotherapeutic agents. So then there is the vitamin B6. So vitamin B6 toxicity. Then comes a multifocal CIDP. So there's multifocal CIDP. Then comes the presence of the vasculitis and the cryoglobulinemia. There's presence of vasculitis as well as the cryoglobulinemia. Then comes the presence of amyloidosis. There's presence of amyloidosis. There is sarcoid. There's infections. So infections, it involves a leprosy. So infections, this is all in asymmetric. Asymmetric, multifocal CIDP. There is vasculitis, cryoglobulinemia, amyloidosis, sarcoidosis, infections such as leprosy, Lyme, hepatitis B, C, E. Then also the presence of the leprosy. So it includes the infections such as the sarcoidosis, infections such as leprosy, there's Lyme, there's hepatitis C as well as hepatitis C, there's hepatitis E, then there's also presence of HIV, CMV as well as a tumor infiltration. Next is the compressive mononeuropathy, a plexopathy as well as a radiculopathy. There is involvement of compressive. There's compressive mononeuropathy. Compressive mononeuropathy. Then there's involvement of plexo. There's plexopathy as well as there is radiculopathy. There is involvement of radiculopathy. Then comes the polyradiculopathy. So there's polyradiculopathy or the plexopathy. So polyradiculopathy or the plexopathy. And this is basically due to the DM. DM stands for the diabetes mellitus. Next is the asymmetric sensory loss. It includes a cryptogenic. So there's involvement of cryptogenic. So there's cryptogenic as well as the idiopathic. There's cryptogenic as well as idiopathic sensory polyneuropathy. There's polyneuropathy. So this is known as the CSPN. To learn and grow daily like this, please do subscribe.